Welcome to this extended and comprehensive audio summary of the research article Client's Understanding of Instructions for Small Animals in a Veterinary Neurological Referral Center. Introduction. Veterinarians typically prioritize providing the highest level of medical care to their clients, often overlooking the importance of educating and empowering pet owners, which can significantly impact therapeutic success. This imbalance is reflected in the paucity of scientific literature investigating clinician and pet owner interactions in veterinary medicine, compared to extensive publications in human medicine. This study aims to investigate the comprehension of discharge instructions in a veterinary neurological referral center and identify factors that influence clients' understanding and recall of this information. Background. In human medicine, clinician-patient interaction and its effect on outcomes have been extensively studied, particularly regarding discharge instructions. Research has shown that written discharge instructions improve comprehension and recall of information provided, increasing correct medication usage and overall understanding. However, similar investigations are lacking in veterinary medicine. This study addresses this gap by evaluating how well clients understand and recall discharge instructions for their pets in a veterinary neurological referral center. Methods. The study was conducted using a prospective cohort design at the Neurology and Neurosurgery Service of the Department for Small Animals of Leipzig University. Owners of dogs and cats hospitalized for neurological diseases were asked to participate. During discharge, owners received verbal and written instructions about their pet's disease, diagnostic tests, treatments, medications, exercise restrictions, and prognosis. A questionnaire consisting of 3 parts was developed to assess owner characteristics, their perceptions of the discharge conversation, and their understanding of the pet's condition and care instructions. Part 1 included questions about the owner's age, gender, educational level, native language, and medical background. Part 2 included questions about the owner's subjective feelings during the discharge conversation, such as feeling informed, the atmosphere, the clarity of explanations, and the clinician's empathy. Part 3 addressed the diagnosis, performed diagnostic tests, treatment, follow-up visits, and prognosis. Owners completed the questionnaire at 2 time points, immediately after discharge and 2 weeks later. The discharging veterinarians also answered Part 3 of the questionnaire at the time of discharge. The responses were analyzed to determine the raw percentage of agreement (RPA) between the clinicians' and clients' answers and identify factors influencing the RPA. Key findings. General agreement. Of the 230 clients approached, 151, 65.7%, responded to the first questionnaire, and 70, 30.4%, responded to the second. The overall RPA between clinicians and clients' responses was 68.9% at discharge and 66.8% 2 weeks later. Areas of low agreement. Questions regarding adverse effects of medication, residual clinical signs, and confinement instructions had the lowest RPAs at the first time point, 29.0%, 35.8%, and 36.8%, respectively. Influencing factors. The age of clients negatively influenced RPAs, with clients older than 50 years having lower agreement rates, p equals 0.008. The duration of the discharge conversation, the number of attending adults, and the presence of pets during the conversation also influenced the RPA. Subjective perceptions. Clients generally felt sufficiently informed and found the amount of information appropriate. However, some felt stressed during the discharge conversation and indicated that they did not understand the veterinarian several times. Objective data. Data collected about the discharging veterinarian, including age, gender, years of clinical experience, and specialist status, were analyzed to determine their impact on the RPA. Discussion. The study highlights that clients can only partially reproduce information provided at discharge, with significant variation depending on the type of information and individual client characteristics. Older clients, in particular, had more difficulty recalling the information. This finding underscores the need for veterinarians to tailor their communication strategies to enhance understanding and recall, particularly for older clients. The results align with previous research in human medicine, emphasizing the importance of providing written instructions to complement verbal communication. Written instructions have been shown to improve comprehension and adherence to medical advice, which can ultimately lead to better health outcomes for pets. Implications for veterinary practice. Improving communication. Veterinarians should ensure that important information is stressed during the discharge conversation and provided in written form. They should also consider the client's age and other characteristics when delivering instructions to enhance understanding and recall. Tailored approaches. Tailoring communication strategies to individual clients, particularly older ones, can improve the effectiveness of discharge instructions. This may include using simpler language, speaking more slowly, and providing opportunities for clients to ask questions. Enhancing recall. Providing clear, concise, and written discharge instructions can significantly enhance clients' recall of information. This approach can help ensure that clients understand their pet's condition, necessary treatments, and follow-up care, ultimately improving therapeutic success. Training for veterinarians. Training programs for veterinarians should include modules on effective communication strategies, particularly for discharge instructions. This training can help veterinarians develop skills to better educate and empower pet owners. Conclusion. This study underscores the importance of effective communication between veterinarians and pet owners and highlights the need for tailored approaches to enhance understanding and recall of discharge instructions. Thank you for listening.